Okay, welcome back. We're going to go over now the nursing, second step of the nursing process, defining our nursing diagnosis or nursing problem. I like to use nursing problem and problem statement, I think a little better than nursing diagnosis. I think it better describes what you're actually doing. And I think as a student, it helps you make those connections a little better. So we now have assessed, we have collected data. So our diagnosis occurs only after we have collected data. All right, come on. I does not want to, come on, go to the next one. There we go. So sorry about that. A nursing diagnosis or problem. A nursing diagnosis is defined by the North American Nursing Diagnosis Association, or NANDA, and it has the I by it because it's become more international now. It's a clinical judgment concerning a human response to health conditions or life processes, or a vulnerability for that response by an individual, family group, or community. All right, that is a mouthful, and it kind of seems like maybe it goes around in circles or it's hard to understand. But breaking it down is it's a clinical judgment concerning a response to a health condition or to things that may happen in your life, like the death of a spouse may cause depression, and depression tends to lead to illness because your immune system crashes. Or you could have a risk or vulnerability. Let's say that you broke something and you are more immobile, so you could get skin breakdown from shearing, trying to transfer yourself. So with immobility, you're at risk for skin breakdown. That kind of thing. And also, it could be a response by an individual, family group, or community. So, a nursing diagnosis doesn't just have to be the individual patient, it can be something happening to a family. We must remember that a nursing diagnosis or problem provides the basis for the interventions that we're going to select in our fourth step. So we've got to have our assessment first, and then our assessment is going to drive the diagnosis. We're going to figure out what a problem is and then go from there. So the nursing diagnosis is related to your scope of practice and your practice standards. Okay, RNs are the ones that are responsible for making nursing diagnosis, but the other healthcare staff that you work with are certainly going to contribute because they're going to be collecting data just like you are. You will probably be taking blood pressures and listening to apical pulses, listening to lungs, bowel sounds, all those kinds of things involved with assessment. But your vital signs are probably going to be taken in the morning by your CNA. You are responsible for looking at those vital signs, and particularly the weights, the vital signs, the intake and output. You are responsible for knowing what your patients are doing. So even though you are going to be responsible for writing that nursing diagnosis or problem, you are still responsible for the assessment data on that patient, even if you delegated someone else to get it. So the domains of nursing diagnosis are going to include only health states that you as a nurse are educated or licensed to treat. So your nursing diagnosis are going to be things that you can do. Now, some of the diagnosis, you're going to identify interventions, but those interventions are going to require that you call the doctor and get an order. But that is certainly within your scope, and that is certainly within the realm of what you would need to be doing, and that all relates to coordinating care and identifying interventions to deal with the problems that you're going to identify. So the nursing diagnosis is a problem, or is a problem, and it is your judgment that it is a problem, and you're going to arrive at it after a systematic assessment and collection of that assessment data. And it's going to describe a continuum of health states. It may include deviations from health. Again, it may include the presence of risk factors or areas that we want the patient to grow in, like taking a medication correctly. And it even talks, we'll be talking about health promotion, getting the screenings they need to get to stay in good health. Changing their diet, changing their lifestyle, things that are going to enhance their health. So identifying a nursing diagnosis or a problem requires a knowledge of the common terms used with the nursing diagnoses, a knowledge of the difference between a nursing diagnosis and a medical diagnosis, and knowing the different types of nursing diagnoses. Also, you've got to know the components of a nursing diagnosis, which we're going to be discussing all of those parts and pieces in just a few minutes. We have posted the current NANDA list on Moodle. It's under your clinical section, and you need to get that list. You need to put it in a sleeve protector or have it laminated, or make sure that it is available when you go to clinical. And also, I would say that when we start to studying the different concepts, that you will have that handy and relate the NANDAs to the concepts. The difference between a nursing diagnosis and a medical diagnosis. The nursing diagnosis, as we stated before, is one that the nurse chooses depending upon the assessment data, but it's also within her scope of practice. And many of the things that we can do and that we can, quote, diagnose or state as problems are within our scope of practice and with our realm. And it has to do with, a lot of times, the physical aspect of the patient and sometimes the emotional, spiritual, psychological side of the patient. But it is all in a caregiving attitude. A medical diagnosis, on the other hand, is one that attaches a diagnosis to a set actual diagnosis of a disorder. It is done by the physician. It could be done by a nurse practitioner or a physician assistant, but it's usually going to be something like with the symptoms that we discovered before, we talked about before in the previous slide with the respiratory infection. The medical diagnosis perhaps for this patient would be pneumonia. Now, you as a nurse can suspect that it's pneumonia, but you cannot actually diagnose that is pneumonia. It is the doctor taking all of those assessments, looking at chest x-rays, and coming up with that medical diagnosis. You can recognize that it is an infection, and you, in your mind, should know, okay, I need to force fluids, I need to make the patient cough, deep breathe. You can start thinking these things in your head when that is part of the nursing diagnosis. You have said, you have stated a problem, and then you start to think about interventions. And the interventions and what you think about are all things that you can do in your scope of practice. The types of nursing diagnosis, again, you'll be familiar with those. We're going to talk about those in a few minutes, and the components. So I think I stated this at the very beginning of this presentation. The nursing diagnosis is a problem statement. It can be a problem-focused statement, it can be a risk statement, it can be a health promotion statement, or it can be a syndrome statement. But it is a problem statement. You are taking that assessment data that you just got and looking at the clusters and figuring out what it is the patients need based on that assessment data and the problems that that data may indicate. A problem focused, it would be the one like the respiratory infection that we were just talking about in the previous presentation. A risk statement has to do with, given a set of circumstances or a particular diagnosis, it can put the patient at risk for something, and we want to prevent that from happening. So a risk statement will take the assessment information, analyze it, and say, oh, because this and this and this is present, this patient is at risk for this. So you want to do interventions that are going to prevent that from happening. A health promotion statement would be one when you're trying to teach the patient, like to take medications, to have lifestyle changes. And then there are a few syndrome statements, like frail elderly syndrome. And the syndrome statements are more rare, but they are things that have very common threads, that 100 people may have this frail elderly syndrome, and they're all going to be very, very, very similar and react and progress in the same ways. So the components of a nursing diagnosis, you're going to have the diagnostic label, and that diagnostic label tells us what the problem is. You're going to have the etiology, or the cause. So what is the cause of, what is it related to? What is this problem related to? And then you're going to have defining characteristics. So what does the assessment data tell you? Your assessment data is going to, a lot of times, be your defining characteristic. So and it is your evidence that there is a problem. So with your diagnostic label, what is the problem? Let's go back to our patient that had the fever of 101.2. They had green sputum, foul-smelling sputum. You heard crackles in their lungs. They were short of breath. They had that productive cough. So what do we think that problem is? And then what do we think the cause of that problem is? And what tells us that is a problem? So that's what we're going to break down. So modifiers, you need to understand modifiers, because here we have this problem with this respiratory infection. So when we try to go figure out the problem statement, is something deficient? Is something impaired? Is something decreased? Is it ineffective, or is it compromised? So when we think about someone having mucus in their lungs, they're coughing up some sputum, but they still have, you can hear it when those crackles, they still have it in their lungs. We have to decide, is that something that's inadequate in the patient? Is it impaired? What's decreased? Or is it not producing the desired effect? Is it ineffective? Or is it compromised? Our etiology is the factors. That's the cause of the identified problem. And this can be a medical, this can actually be a medical diagnosis. Or it can be like with our patient who has the cough and the sputum and the fever, and we know it's a respiratory infection. That respiratory infection is the cause. That's what's causing the fever. That's what's causing the sputum. That's what's causing the sound, the adventitious sounds in the lungs. So we can say that that etiology or cause of this patient's problem is the respiratory issue, is the respiratory infection. So our defining characteristics, we take our cluster of signs and symptoms and that indicate the problem, and that is our defining characteristics. I'm going to skip ahead because I was talking about our little, when we talk about writing our nursing diagnoses. You're going to find on your list impaired gas exchange. You are going to find ineffective airway clearance. So when we're talking about the patient that is having sputum, it's coughing, fever, all the adventitious lung sounds, the nurse came up with two possibilities. She, let's say the doctor has read the chest x-ray and now says that it's pneumonia. So she knows it's pneumonia. So she knows that the mucus and the secretions from pneumonia could impair gas exchange. Now, let's say that you have also, being the wise nurse that you are, with all of these symptoms and with the patient saying they're short of breath, you have obtained her O2 saturation, which is 95%. That is a normal range. It's a little lower than we like. We'd like to see it at 98, but it's okay. So we know that's within normal limits. So if her O2 sats are within normal limits, there is gas exchange occurring, and impaired gas exchange would not be the problem, would not be the diagnostic statement, impaired gas exchange. But the nurse also knows that with pneumonia, there is thick mucus secretions that can obstruct the alveoli. She also has assessed the crackles, the diminished breath sounds, which substantiate this. So this patient is coughing up sputum, but not enough to clear the airway. Therefore, ineffective airway clearance is the most appropriate nursing diagnosis for this patient. So you see how this works? Okay. We had our cluster of signs and symptoms that indicated a risk or problem, which is ineffective airway clearance. And so the signs and symptoms can be objective or subjective. But just about all of her signs are the objective signs that we talked about earlier. There are two-part statements. Now, your book gives a couple examples of two-part statements, but as students, Ms. Pacinic and I kind of talked about this. We prefer that you just do the two-part for risk statements. So with a two-part statement, you have a potential problem written with an and a label, and then you have the cause of what is the potential cause of the problem. Now, you don't have any defining characteristics yet because the patient is at risk. We don't want those defining characteristics to show up, okay? We have a patient that is at risk. So a two-part NANDA or problem statement is usually a risk statement. And so let's say that our patient has a hip fracture, which is going to make them pretty immobile, all right? So we know that they're going to have a lot of pain with a hip fracture. We know they're not going to move around as much as they usually do. So both of these factors can cause constipation. So our risk statement would be risk for constipation as related to immobility and pain medications. So there we have our two-part diagnostic statement. Constipation is the possible problem, that's the risk, and then our cause is immobility and pain medications. So risk statements, you only need two parts when you're talking about writing your nursing problem statement or your nursing diagnosis. But then when we get to a three-part problem, there is a problem there that we've identified. We have what's causing the problem, and then we do need to have what was assessed or what led one to believe there was a problem. That would be your defining characteristics. You have to have an etiology. I don't think I explained that well enough when we were talking about that a few minutes ago. You have to have an etiology because if you look back here, there's more than one thing that can cause constipation. They could be at risk for constipation because they did not eat enough fiber. They could be at risk for constipation because they had some difficulty with innervation in their colon. So there can be different causes for constipation. So that's why we have to have the etiology there. We have to know what is the cause, because that cause will lead us to the interventions we want. An intervention for someone who has poor innervation in the colon, there are going to be some similarities, but there are going to be differences in what you decide to do about it. So when we get back to the three-part problem, we still got to have the etiology telling us what the cause of the problem is, and then we have to have our defining characteristics, or what is it that we assessed that led us to believe there was a problem. And so as we get back to our person with the green-colored sputum, the foul-smelling sputum, the productive cough, the temperature, the increased respirations, the shortness of breath, and the crackles, that's our third part of our statement. That tells us why we think there's a problem. And then we now have, as we sit here, we now have the diagnosis from the physician that the patient has pneumonia, and we do know that the O2 sats are okay. So we're going to take our cause, and we're going to take our evidence or our assessment data that proves that this is a problem, and we're going to write our three-part nursing diagnosis. So we're going to say ineffective airway clearance related to pneumonia as evidenced by crackles and diminished breath sounds. Okay, I know all of this is overwhelming, but if you just break it down, we already went through the reasoning for why we came up with ineffective airway clearance. The doctor now tells us it's pneumonia. We could have put related to respiratory infection if we had not known that right now. So it's ineffective airway. That's our problem in airway clearance. The cause, pneumonia, and our evidence is crackles and diminished breath sounds. So we want to make sure that we're verifying and that we confirm the accuracy and relevance, and we're going to do that by assessing and reassessing, assessing and reassessing. So we want to just go back. Okay, are we sure that we have that correct? Yes, we do, because we have that cause, we have that problem, we can still hear those crackles in the lung, and they're still producing sputum, and we can see those diminished breath sounds. We want to build a good knowledge base and acquire clinical experience. So this all comes easier the more that you assess patients, the more that you collect data. We've got to have a working knowledge of what is normal. If you notice, we knew that you shouldn't be hearing adventitious breath sounds. And we know that a temperature of 101.2 is not normal. When the O2 sats were obtained, we knew that that O2 sat was 95%, that was okay within the normal limits. Our respiratory rate at 28, that's high. So we know that is not normal. So you have to know that you have to know your knowledge of normal and abnormal. You have to be willing to consult resources to find evidence-based practice or the best practice. If you're not sure about a set of cues or symptoms, then you need to consult resources and ask and research it. We want to base our diagnoses on patterns, and that is on the behavior over time rather on a single isolated incident. That's why we're going to verify, we're going to assess, we're going to reassess. There's all kinds of wonderful tables and boxes in this chapter in your book. So a word to the wise, you need to be familiar with the table on 3612 on page 2506 in the third edition of Pearson, the guidelines for writing a nursing diagnostic statement. In your textbook, there's lots of wonderful examples to maybe help clarify this, and I would hope that you had read the chapter before you listened to this PowerPoint or to this presentation. Otherwise, you're going to be extremely confused. And don't worry, we are going to practice this in class. So step 3 in the nursing process planning, we will go to that in the next presentation.